Hello, I'm Dr. Kelly, OMD, board certified OBGYN and healthcare executive. I am the CEO and owner of KOE Medical Consulting, which we have a program called Viva Life SPFME. Viva Life means to live life, and we want you to live your healthiest and wealthiest life spiritually, physically, financially, mentally, and emotionally. The way that we do that is through opportunities just like this, where we educate, encourage you, and inspire you to be well informed about your body and your health. Today, we're going to be talking about how to screen and prevent cervical cancer. Here's my information just in case you don't look at the whole video, but here's how to contact me. If you would like me to come speak to one of your groups, as well as you want to book a consultation with me individually, go ahead and go to my website, www.drkellyomd.com, or go ahead and follow me on Instagram or Facebook. We can definitely connect there. So let's go ahead and get into it. Cervical cancer, the history of cervical cancer in the United States. So at the beginning of the century, approximately 1920s, cervical cancer was the leading cause of death in women. We had about 40,000 women dying from cervical cancer each year. A gentleman, a scientist, a doctor, in 1916 by the name of Dr. George Papanicolaou, who is considered the father of cytology, was doing research on guinea pigs and saw that guinea pigs' vaginas had abnormal cells. He thought maybe this could be consistent in our own human physiology. So in the 1920s, he got samples from volunteers and did research on this and found that, yes, it was true that human beings, women, did have abnormal cells on their cervix and in their vaginas. When he initially presented this information to scientific rooms, they did not believe him, likely because he was Greek. But eventually, with persistence and collaboration of other scientists who did believe him, they were able to do more research and founded a screening test called what we now call the Pap smear test. In the 1950s and the 60s, this test became widespread and wide known and became the number one way to reduce cervical cancer in women. In actuality, it reduced it by 80%. Now, there's a very important woman that is involved in this research. Unfortunately, she never had informed consent, but her cells were utilized to further on significant research and education about cervical cancer and many other cancers. Her name was Miss Henrietta Lacks. She lived from 1920 to 1951, and she was an African-American woman who we have called her cells the immortal cells, also known as HeLa cells. And because of her and many others who were not allowed informed consent due to their race and racism, now every American in the medical system is required to have informed consent before we perform any type of research on them or to them. Now, I'm going to tell you the bottom line up front once again, just because this is important. Now, how do we screen for cervical cancer? Cervical cancer, like I said, started out as screening with a Pap smear. Well, now there are 3 different ways you can screen for cervical cancer: the Pap smear, the HPV high risk test, or the Pap smear and the HPV high risk test. Now, you can see if you're under the age of 21 and you are average risk, meaning that you don't have any significant disease, you don't have any abnormal bleeding or STDs or pain, or you don't have anything that has been found on your cervix to look abnormal, then you will not need a Pap smear until the age of 21. But it's really important for us to understand that a Pap smear is different from a well woman exam. A well woman exam is a head-to-toe exam to include listening to your heart, your lungs, to evaluate your breast as well as your abdomen, do a pelvic exam, internal and external, as well as ask you very important questions and to get your vital signs. Now, the Pap smear means that I am going to place you on a table, that we're going to do an exam on you, but we're also going to do an internal exam where we look inside of your vagina and see if there's anything visible that's abnormal, as well as take a sample of those cells so that we can send them to the lab. That sampling of your cervix is called a Pap smear. Now, between the age of 21 to 29, there's a different recommendations. You can do a pap smear only, which can be done every 3 years. Or if you're over the age of 25, you can do an HPV high risk test, and that is for women over the age of 25. Now, if either one of those pap smear or HPV high risk tests, it comes back positive, we do need to do more testing to figure out what risk stratification you have. Now, between the ages of 30 to 65, you have 3 different ways to screen. 1, you can stick with the pap smear only every 3 years. 2, you can do the HPV high risk testing. Or 3, you can do the pap smear plus the HPV high risk testing, and that's called co-testing. If those tests are normal, depending on which ones you do, you can space out your pap smear or HPV testing from 3 to 5 years. However, if they are abnormal, we need to see you in the clinic and we need to figure out what's going on with more testing. If you're over the age of 65 and you have had completely normal testing for at least 10 years without a history of cervical cancer, then you can stop getting testing done. Now, remember, testing is different from a well woman exam. So you should still go in to see your primary care or your OBGYN, family medicine physician, once a year so that you can make sure that you are getting screened appropriately from head to toe for any type of preventable disease. And lastly, what if you've had a hysterectomy? Now, this means that both your uterus and your cervix have been removed, because now there are times when people do not remove their cervix. If both of your uterus and your cervix have been removed and you do not have a history of abnormal cells or cancer, then you can stop having HPV or pap smear testing. Please, 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 anything that I say, make sure you review this with your primary care or OBGYN. All right, so we've been talking about the pap smear and we have to go back to the basics, our anatomy. So I've posted here both female and male anatomy. The reason why is because HPV doesn't only happen in women. It happens in men and women. As a matter of fact, men are typically the vector with the penis, and women are typically the receiver because of the vagina and the cervix. Now, if you are having same-sex relations or you are a transgender member, now we'll need to talk about that separately in a consultation or conversation with you to figure out what type of screening needs to be done for you and your significant other. But as you can see, at the top is the female reproductive center. We talk about the brain because that's where our hormones are. And then we talk about the vagina and the uterus and our ovaries and our tubes. The reason why these are important is because you technically can have cancer in any of those places. Today, we're focusing on cervical cancer. And then, of course, for men, we talk about the penis and the testes. Remember, you can have cancer in either one of those places, and we need to make sure, including the prostate, and we need to make sure that we screen for those at their appropriate ages and prevent ourselves from contracting the diseases that cause it. So here, more information about the female anatomy. You can see the clitoris, the labia major, minor, as well as the anus. And then you can also see the uterus, cervix, tubes, and ovaries. There's external and there's internal ways of examining each of these areas. And that's what I'm talking about when we talk about doing a well woman exam. Moving along, so the cervical cancer stats, really important. Remember I said it was the leading cause? Well, it's the 4th most common cause in women of cancer and cancer deaths. It is caused by a virus called the human papillomavirus. A lot of words. We shorten it and we say HPV. So over 500,000 new cases across the world have been discovered in 2018, and approximately 11,500 just in 2020 alone. 90% of the deaths that occur in low and middle income countries. And guess what? That includes the United States of America. It is a preventable disease, however. And if we focus on that prevention, the education that we're giving you today, and if you believe in vaccinations, we will be able to significantly further lower the incidence of cervical cancer. However, Just remember, when we find it, we also have to have personnel, so providers, physicians, surgeons, who can also treat when we find the abnormalities. So we need to continue to encourage our youth and anyone really to become doctors, nurse practitioners, surgeons, so that we can make sure that our healthcare is taken care of, not only in the US, but around the world. So what is human papillomavirus? Well, number one, it's a virus. It's the number one risk factor for cervical cancer. And HPV is a group of more than 200 different types of viruses, but there are several, just a few, that are the high risk types. The numbers you're going to mostly hear are 16 and 18, 31, 33, 52. There's a few more, but I want you to remember that there are over 200 different types of HPV viruses. And that being said, although we can't prevent them all, we can definitely screen and decrease the risk for them progressing to cervical cancer. So the HPV virus infects the cells of your vagina and your cervix, the penis, or actually any oral, anal, vaginal surface. And the important part of this is most of the times our bodies, if you are healthy and have a good immune system, can actually prevent this HPV infection from becoming chronic. But in some people, it is chronic. And what did we say the way to find that? If you have HPV, to test for it. So there are low risk types of HPV and there are high risk types of HPV. The low risk types are typically the ones that cause genital warts. The high risk types are the ones that can lead to cancer if we are not screening appropriately on a regular basis. So what about this HPV high risk testing? So as I said, the pap smear essentially was a cellular test. We look at it, we look at the cells under a microscope, see if there's anything abnormal with the cells. Well, with the HPV high risk testing, we are using or potentially using PCR, and we're looking at the DNA, RNA of that cell type to see if that HPV is there. If it is there, then further evaluation is warranted. Now, there's only 2 FDA-approved available tests for HPV high-risk testing. And that's part of the reason why, number one, a lot of people don't know about it. And number two, a lot of people are not able to get it because it does cost money. And if you have our, US insurance, then you're able to get this test done. If you are uninsured or have low income, you're also able to get this test done with the utilization of nonprofits. So important thing, people ask, well, if it's getting so much easier, why can't I do this myself? Now, the FDA has not approved a HPV self-sampling test. However, there are companies that are out there that do provide HPV self-testing. And if you're the type of person that either can't get into a physician, prefer not going to a provider or a clinician, then you too can look this up on your own and do your HPV testing. As I said, it is not FDA approved in the United States. However, as long as you are educated, you can do what you think is best for you. So, question, which one of these helps prevent cervical cancer? Correct. Condoms, female condoms, male condoms. But also, the number one way of preventing cervical cancer and HPV is don't have sex. But we know a lot of people do, so we have to give you other options about how do we prevent this. So we said, use condoms consistently every time. Get screened according to your age and your medical history. The recommendation is to not smoke, as well as not have HIV or AIDS or any other immunocompromised diagnosis. And the recommendation is also to vaccinate. So what is the HPV vaccine? Well, there are a few, 3, right? FDA approved vaccinations, and I've listed them there. But essentially, the HPV vaccination is a purified virus-like particle, okay? It is not the actual HPV, but it resembles the HPV virus. And I've listed there the protein of the common types of HPV in the 9-valent HPV vaccination, as well as the quadrivalent and the bivalent. So those are the 3 types of HPV vaccinations you can get. And what they do is they cover the most common types. And do you remember the most common types I said there were? 16, 18, and then all the numbers that are in the 9, okay? Now there's a newer one that covers the 31 specifically as well. So all 3 HPV vaccines protect against HPV types 16 and 18, like I said, and those are part of the most common cancers, HPV types. Now, this is an eye chart, I know, but the most important thing is for you to see which companies actually are testing for HPV and how they're testing for HPV. So these are for my, medical providers or my clients who are very interested in the science behind this. But remember, there's more than 200 different types of HPV. So even if you get the vaccine, you still need to be screened. So how is HPV and cervical cancer diagnosed? On the right, I have a graph and the references there that shows you the most common types of HPV in women over the age of 25 and their risk of the high risk dysplasia, okay? So the way that it's diagnosed is we do a pap smear or HPV high risk testing. Once you have that done, listen for the words SIN1, SIN2, SIN3, or AIS. That's for the pap smear. And sometimes you'll hear people say, oh, you have a low, moderate, or high risk pap smear. You want to know the specific words. Second, HPV high risk testing. This is going to tell you whether or not you have one of those types that I listed. And if you have one of those types that's listed, then we need to do follow-up testing for you. And that will include a pelvic exam that's called a colposcopy. And if that is found positive, we are going to need to do biopsies for you. Now, if those biopsies come back positive, consistent with cancer, then we're going to refer you to a GYN oncologist. And that person is going to do the rest of your workup. If your testing does not come back as cancer or a high-risk precancerous cell, then we potentially will watch you. So if you hear something called SIN1, then we're going to repeat your testing in a year. If you hear something called SIN2, 3, or AIS, then we're going to do a shave biopsy or something a little bit more significant so we can reduce the infection and the burden of the abnormal cells that are there. This is very, very important. As mentioned, if we think you have cervical cancer, we will do a full head to toe exam. We will also potentially do some radiology, not potentially, but we will do some imaging, and we will get you referred to a GYN oncologist. So how is HPV cervical cancer treated? So cervical cancer is treated in several ways, and it depends on the type and how advanced the disease is. As mentioned, if it is very localized, there is a potential that your physician will take you for a procedure called a LEEP procedure or a cone biopsy. If it is more widespread, then as mentioned, we are going to utilize our GYN oncologist, and they're going to do surgery. They may also offer you chemotherapy as well as radiation. And that is specific to the type and the spread of cervical cancer that you have. So when should you talk to your primary care, a pediatrician, or an OBGYN about this? So number one, we talked about you should have an annual well woman exam. And I still believe in this, and I believe in it because I know it saves lives. The annual well woman exam should include a head to toe exam. Somebody should be listening to your history, understanding what medications that you're on, what your allergies are, and examining you from head to toe. Included in that, you should have the question about if you're female, about your cycle. Your cycle is very important. It tells us a lot of things. If you're having abnormal discharge, if you're having abnormal cycles, if you're having pain or bleeding, especially during or after intercourse, And if you are menopausal, meaning that you no longer have periods for a year and you're starting to have bleeding, we need to evaluate you. Most of the patients that I have seen in the United States, besides a rare few, have had their children, have not gone back to the physician, and unfortunately have been diagnosed with cervical cancer 5 to 10 years after that. So really, really important for you to talk about this, not only with your physician, but with women and men that you love. Now, important thing about men. Men can get HPV and they can get associated cancers. So, as I said, any external or internal organ, well, internal organ for women, so vagina and cervix, cervical, vaginal cancer, men, penile cancer, both any type of oral, okay, so mouth or anal cancer is associated with HPV and that can cause cancer. All righty, so let's go ahead and take a quiz. Question: what causes most cases of cervical cancer? You have to answer because I already know. Everyone should get the vaccine. True or false? Men and women can lower their risk of HPV and HPV-associated cancer. True or false? When should the average woman start getting her pap smears? And when should she stop getting pap smears? Should women get pap smears every year? True or false? But what should we be getting every year? And if you have cervical cancer, will you know right away? Is it normal to have spotting or bleeding after menopause? And can cervical cancer be cured? If you want to take that quiz, you can go to cdc.gov and put cervical cancer quiz in. And then also, when you have me come see you or do a virtual Zoom webinar, then you can also get the answers to these questions. But I know you go to cdc.gov. Also, it's in my recording, so go ahead, rewind, and if you got the questions wrong, then I want you to go ahead and review that part of the webinar. Here are the references from doing this webinar, and I really appreciate your time today. If you want to get in touch with Dr. Kelly OMD, then go ahead. I'm on Facebook as well as Instagram, Viva Life Health Hub at Dr. Kelly OMD. You can also go to my website, www.drkellyomd.com. Thank you so much for this opportunity, and I look forward to continuing to educate, encourage, and inspire you to live your healthiest and wealthiest life.